Gentleman with a microphone, and he's going to find folks with their hand up. It's your call. Why don't you identify yourself?
Yes, Bill Paul, New York Presbyterian Hospital, and a member of the Maxwell Advisory Board, which I'm very proud of. A couple questions on health reform as it was ultimately enacted. In other words, the total package of health reform. The Affordable Care Act, ACA. Are there parts of it that you think are good and fundamentally sound? And I guess more importantly, do you think it reflects this larger American culture that you're trying to understand and express in your book? And finally, is it a left wing, right wing, or middle of the road construct?
Yeah. Well, you know, there are parts I like. I like the exchanges. I like the cuts in Medicare. But you know, I was a big fan of the sainted Wyden-Bennett plan, which would have created more choice while mandating coverage.
Would have unhinged insurance from employment, essentially.
It would have, yes. So politically kind of tough to do. But I thought that was the way to go. It gotten rid of the exemption for tax insurance or for health and care insurance. Politically very tough. But I thought that was more in touch with the country because it emphasized choice. And the public reaction against the health care plan was a reaction against a lot of things, but primarily a reaction against the sense that people did not hear the rhetoric of choice and individual responsibility. What they heard, and they were accurate about this, was that there were going to be boards of people in Washington, and it became stupid. It became death panels and all that stuff. For the record, I'm pro-death panels. But, but the president really has a much greater faith than I do in boards of smart people getting together and devising solutions. So they have great confidence in this board to reduce Medicare costs. And they've, even in his last speech, he gave them even more power. I'm really dubious that boards are smart enough to plan the healthcare system and plan cost reductions. Unelected boards can impose these horrible choices on people from Washington. I'm very skeptical of that. So essentially, we have this situation where Medicare and the rest of the healthcare system is not going to be able to afford to pay for all the new things technology is coming up with. So how are we going to ration, if you want to use that word? Well, either we could have a centralized board do it, which is what happens in a lot of places and what they choose, or we could have some sort of market-based mechanism do it. And obviously some people say the market-based mechanism doesn't work. And so the question is, who's going to make the decisions, the individuals or the boards? And there's probably some mix that we'll end up with. But I was a little disturbed by the tremendous emphasis on centralized boards of technocratic decision makers.
Okay. There's a question when we work our way over this way.
Hi, Dan Rose. David, if infants can be trained to prefer 2 marshmallows later rather than 1 marshmallow earlier, isn't that an argument, a powerful argument, a compelling argument in favor of massive preschool education for the dysfunctional poor?
Yes. You know, this is where the rubber hits the road for anybody. Dan is mentioning does everybody here know the marshmallow experiment? I'll assume everybody knows. It's an experiment where at age 4, they can tell with tremendous accuracy what your income is going to be at age 20 and age 30, based on how well you exercise self-control at age 4. And so basically, if you grow up in a middle-class home, you don't need any. You've established relationship, you've lived up in a home where actions lead to consequences, and you've developed strategies to control your impulses. A lot of kids have not grown up in that kind of home. And so the public policy challenge is, do we want government very paternalistically going in and replacing the culture of disorganized homes? And I think a lot of us have an aversion to the idea of government going in and interfering in family life. And yet the generational cycles of poverty are such that I think we should take the risk on the side of paternalism. And the things that can do it are nurse-family partnerships or sort of the heavy intrusion of institutions like up at the Harlem Children's Zone. And I think it's worth interfering in family life. Some of the programs that work call themselves parent neutral, but what they're really doing is replacing the culture of the family with a different culture. And that's not libertarian, and it's dangerous, but I think it's probably worth it given the disorganization in many cultures. in many parts of the society. But we would have to acknowledge, which we're loath to acknowledge, that in a wildly unequal society, we need unequal or two sets of policies. And one set of policies for people who are growing up in disorganized cultures, and another set for those who aren't. And that's a tough thing politically to acknowledge in public.
But aren't we also living in a time now which is in a reaction in part to the ease with which the well-to-do intervened in the families, in poor families and the lives of the young, and felt much more confident to terminate parental rights for people who weren't there enough, and we've been living in a time of trying to counteract that, what was perceived as an arrogance. You're saying we should feel more comfortable with a more measured confidence.
Yeah, well,
not arrogance.
it's a very tough call. I mean, one of the things, again, my doubt of planners.
Mm-hmm.
You know, if you started as I did, covering the Robert Taylor homes or the Cabrini Green, the big projects in Chicago, we had planners come in thinking they saw these terrible neighborhoods, and they tore them down, and they put up these nice new buildings. But they didn't appreciate the neighborhoods looked terrible, but there were actually social support networks that the people had established. And when they tore down the old neighborhoods, they tore away those support networks, so the new buildings became uninhabitable. So as we interfere in family life, what are we tearing away unintentionally? That's a thing. But, you know, I go to these early childhood programs in Chicago and elsewhere, and the number of kids where you hear the stories of the kids, they've been sitting in car seats 8 hours a day in front of the TV. And mom's been putting Coke into the milk bottle just to get them to be quiet, because mom's under tremendous stressor and might be suffering some mental issues and things. And so you see this cycle repeating itself. Do you do nothing? Do you, I mean, how,
Yeah.
you know?
Let's move the microphone. Let's continue to move uptown here.
Hi, I'm George Perlov. I'm a strategic marketing and communications consultant. And to your point earlier about the society going from more of the larger focus on society to more of an individual focus, I'm wondering, can we ever regain that in this country? I know there was a glimmer of that, you know, after 9/11, which I think we all felt was really a lost opportunity. Could it happen again? And what would need to happen in this country to make that work?
Yeah, I mean, a lot of there was just an attack. There was an attack on conformity. I mean, this came to my mind actually. The thing that crystallizes it to me in story form. I was driving home one day, listening to NPR, the Saint Today NPR, and on our local station on WAMU on Sunday nights they have a broadcast called the Big Broadcast.
Big old-time radio shows.
Yeah, so it's old-time radio shows, and I happened to hear one night a show called Command Performance, which was a variety show that went out to the troops in World War II. And they had all the big stars on it. The episode I heard was VJ Day, 1945. Bing Crosby was the host, gets out there and says, just hours ago we've learned the Japanese are surrendering, but we don't feel proud at this moment. We just feel modest. We just feel glad we got through it. And this theme of modesty kept being echoed throughout the broadcast. Burgess Meredith gets out there in the middle, and he reads a passage from Ernie Pyle, the great war correspondent, and Pyle says, we won this war because we have great soldiers, brave allies. We didn't win it because we're God's chosen people. We didn't win it because we're special. We should just try to be worthy of the peace. Just incredible tone of modesty. And then I get home, turn on the TV, watch a football game, and a quarterback throws a pass to a wide receiver who gets tackled after a 2-yard gain, and the cornerback, the defensive player, does what all professional athletes do is he did a dance in honor of his own tremendous accomplishments. And it occurred to me I'd heard more self-puffery after the football game, 2-yard gain, than America did after winning World War II. And that sort of symbolized to me the transition from a culture of self-effacement, which says I'm no better than anybody else, but nobody's better than me, to I'm special. And that polling statistic, I said it earlier, is sort of part of that. And so these are deep cultural trends. The only thing I'd say in an optimistic way, and this is a 2/3 answer, is that people under 30 are tremendously community-oriented. If you look at social indicators for people under 30, the teenage pregnancy rate is down by 1/3, teenage violence is down, domestic violence is down, violent crime for teenagers is down, suicide rates are down. Incredibly wholesome and responsible generation. They're all going to have the biggest midlife crisis in human history in about 10 years. but until then, so there are cycles to these things. What they don't have is an interest in politics.
David, your earlier comments with respect to brain research and complexity of it, et cetera, and the emotions, et cetera, and the view seemingly in Washington with respect to healthcare as basically being a commodity and can be, quote, counted in units. Would you describe your view of, quote, medical science, and I put that in quotes, and the ability to interpret virtually anything in a broad, general way from data, and then tie that up to your planning of all of our lives in healthcare?
Yeah. Well, I mean, I'm not an expert in this particular thing, but I have seen various studies. The number of things that affect how somebody's going to recover from illness or their morbidity rates. Smoking is bad, but something that's really bad is loneliness. And how do we try to create cultures in which that doesn't happen? I saw a study of people suffering from illnesses in Italy, where on one side of the hospital they had a view of basically brick walls. The other side of the hospital they had a view of this nice Italian scenery. And of course the people on the scenery side, their hospital stays were, I think, on average 3 days shorter. And so the idea, one of Descartes' errors, one of the themes of the book and of the research is that we're children of the French Enlightenment, that said that reason is the king of our abilities, and the mind is separate from the body. And we're now learning that research confirms the wisdom of, I think, the Scottish Enlightenment, David Hume, and people like that, which is reason is important, but weak sentiments are strong, and the body and the mind are all connected. And we still have a scientific, I think it's much less so than it used to be, but we still have a scientific establishment that still is more comfortable, like so many of our establishments, talking in these rational terms just of the mind, not of the connection between the two. I think that's changing a bit as the research comes in and as women become more. A lot of this is male-dominated. And as women become more part of ruling structures, then that changes a little. One final medical study that comes to mind, they gave a bunch of a bunch of doctors look at the same symptoms at a patient, and they gave half of them a bag of candy, Halloween candy, and half of them no candy. The doctors who got the bag of candy were much, much more accurate in their diagnoses of the liver ailment. And so all these things feed into how we think. But we should all give them candy. We have a lot of fat doctors.
But the question that I'm reminded of by this question was, and I put this to President Obama in an interview actually, because he insisted that if people know that a test isn't necessary, they won't go have tests. Right. And this happened right after the mammogram release, in which women were told these tests are not necessary. And the reaction was not, oh, well, good, I'll go back and recalculate what's necessary. It's, do I trust the people who are telling me this? What's their motive for telling me that? Right. How is this done? And Obama said, what's the way in which that news was presented? But it was not a simple rational factor saying you no longer have to have a test, don't do it.
Well, in New York City, they now have the calorie counts on the menus, and they expected the calorie intake that people ordered would go down, but in fact it went up. And so there's a mystery. It could be people just react in ways we don't anticipate. It could be that some people just decided not to order at all, so they left, so you got only the heavy orderers ordered. So I'm not quite sure how to analyze that data, but things are not as predictable as one thinks.
Charlotte, you have the...
I'm Charlotte Frank with McGraw-Hill. My question has to do with people influencing other people and Obama. Now, Michelle Obama is a really smart lady. I mean, forgetting about that, she's gorgeous, but she's a really smart lady, lawyer, all of that. What influence do you think that women have, or she might have, on the decisions of the husbands, the men, the president?
Yeah, my general experience of White Houses is the influence of the First Lady is they're always tougher than their husbands. Their influence is very hard to read from the outside until afterwards. So I had a friend of mine who worked in the last administration. They were at Buckingham Palace, and he was a senior official with Bush. And they were at a cocktail reception at Buckingham Palace for the Queen, and Bush was bored out of his mind. And Bush said to my friend, "Let's get out of here. Let's sneak around the palace. I want to see this place." And Laura was right there, and she pointed to my friend and said, "Don't you do that." And so he had to choose, do I obey the president or the first lady? And he told me it wasn't even close. And my impression is, and my impression in this White House too, is that she's much tougher and more feared. And that's actually works both ways. The president, even within the administration, is not feared enough. I often ask people in the government, what have you learned being in this time that you didn't know before? And one of the answers I got was that you would be amazed by how little the sentence, the president made this decision, matters in a meeting. So at a meeting of the deputies, the president will have rendered a decision. Somebody will say, this is what Obama wants, and they'll nod, and then they'll go off as if that sentence was not uttered. And so the president, I think, has to to render the same decision 6 or 7 times, because the first few times nobody pays attention. This is a common problem with presidents, that they all express this. But I don't think too many people are not unafraid of Michelle Obama. I think they're afraid of her, as they were afraid of Laura, as they certainly were of Barbara Bush and Nancy Reagan. And probably Hillary, yeah. Now that I think about it, it's a straight trend. The husbands are the softies. They want to be loved by everybody.
Let's get another